The recording will be available on the Iowa Cancer Consortium's website after today, along with Kellee's slides. So my name is Sarah Comstock. I work for the Iowa Cancer Consortium, and this is the second to last session in our FY13 capacity building series. It's a series that we offer to our membership and to anyone in Iowa interested in learning more about cancer control and issues related to cancer control. Today we have Kellee McCrory today with us. She is an MPH, and she is a research manager with the Iowa Center for Evaluation Research at the University of Iowa, and she's the evaluator for the Comprehensive Cancer Control Program at the Department of Public Health, which includes the consortium. She's going to go through some great information today, and feel free to write questions in the chat box, which again is at the top right-hand corner of your screen. I see right now Rachel used it to say Kellee is an evaluation rock star. So in this box you can so you can leave comments.
Thank you, Rachel.
Kellee has said that you can ask questions throughout the presentation, and if she's going to touch on it later, she might not answer it right away. And then at the very end, if she hasn't answered the question, she'll go back through and make sure we've covered everything. And I think that's it. I'm going to turn it over to Kellee, and I think the first thing we have is a little poll here where we're going to ask to find out kind of where everybody is at with their evaluations and what kind of surveys do you currently do. I'm going to turn it over to Kellee now.
So everyone I can see is clicking on that. So you've got the 5 choices. You don't do surveys. You do them in person, one-on-one. You do them on the phone. You do them via paper or web-based. So it looks like a lot of you do paper surveys. Great. Okay, so let's get going. Again, my name is Kellee McCrory. I'm talking today about survey questions, how to get responses, and so how to write them, how to do a good job writing them, how to get responses to your surveys, and what to do with those responses when you get them. So what are we going to learn in the next 45 minutes? I left about 15 minutes at the end for questions. So ask as we go through, or just if you want to save it to the end, I'll be happy to stay on the line as long as you need to answer questions. So we're going to talk about what is a survey, some good, bad, and ugly survey questions, how to increase your response rates, how to analyze and organize the data when you get it, and then we'll have time for questions at the end. So why would you survey? There's a lot of reasons why people do surveys. One of them is you want to know something about a population. A lot of you work in health-related fields. You want to know something about, let's say, women of a certain age, about health behaviors. You want to know something about teenagers. You want to know something about doctors or nurses or whatever. So you want to know something. You want to know if anything was learned. You've done a training, you've done something, a practice change, and you want to know if anything was learned from pre to post. You pre-survey folks, and you post-survey them and see if there's a change over time. You want to see if perceptions or needs have changed over time. You've got a program in place. As people come in, they take a survey. Let's say you take a survey. Let's say it's a year-long program. It's 6 months. They take a survey to see if their perceptions have changed about things. Help you to enhance, change, or modify the programs. Going back to those other surveys, if you're doing a survey of people about the program and they're telling you that they don't like it, they don't like how it works, they don't like, or they love it, or whatever, you can use that data to help enhance, change, or modify the program as it's happening. And it also, since we're all in health-related fields, helps you to understand health behaviors. And we all know health behaviors is what helps people change things. So let's talk about the birth of a survey. These are the things you really need to know, and if you're going to keep one slide, this is probably it. You need to know who your target population is. That's where you want to start. You want to develop your survey by determining your format. Are you going to do a mail survey, in person, in groups, in a group survey? Internet, a lot of people do internet now. Interactive voice response. Those are those auto dialers that call you at home. Self-administered, pen and paper. Are you going to use open-ended questions or closed-ended questions? Open-ended is a lot of text boxes where people can really expound on something. Closed-ended are the yes-nos, multiple choice, scaling kind of questions. You want to really revise and edit, and you want to test it. You want to test it with anybody within reach who will be willing to sit down and look at it. Because what you're looking for is, does it make sense? Do the questions flow in some kind of order? And does it go to the right cognitive level? So a little cognitive interviewing is when you just pull some folks and have them read it out loud and they tell you what they think the questions mean. So you're kind of saying, can you read these through for me and let me know what it means to you? And if what they're saying it means to them isn't what it means to you, you've got some work to do on rewording those questions. You also want to determine the protocol. How long are we going to let this survey go out for? Are we going to do reminders? Are we going to, if we're doing it by mail, do we need to send around 2? Do we need to send a little card first saying we're going to send a survey so they know it's coming? So what's the whole procedure you're going to go through for that survey? What are we going to do when things start coming back? Where are we going to keep them? Field test it. That goes back to your testing. That's when you start to take it out to people you don't know very well and have them take a look at it. And then you implement. So what makes a good survey? Here in the United States, very clear, simple English. You want to make sure that when you test it with folks, they know they understand it the way you understand it. It also needs to be meaningful to the respondent. It needs to be a survey where someone looks at it and it has some kind of meaning to them. It matters to them to take the time to do it. I am not a fan personally of a lot of text boxes. I think people get very fatigued quickly with writing, and sometimes if you're doing a pilot with a group, you get some writing because that will give you the options for the multiple choice later on the road. But I don't know how many of you take surveys online or whatever. I do a lot of them just to learn, and I am not a fan of text boxes. I don't think people really take the time, and I've found when we put text boxes in things, they'll put fine, good, okay. They don't really put a lot of meat into that. Very straightforward questions, and we're going to show some good and bad survey questions in a couple minutes, but you want the questions to be very straightforward. You don't want someone, remember when you're in college and there'd be those questions that were kind of, you never really knew what they were asking, and your responses were, you know, A but not B, B, C but not D, none of the above. The whole thing was just confusing. You really don't want questions like that. You want people to be able to read it, look at it, and the answers make sense. Does not take a lot of the respondents' time. People are very, very, very short time spans nowadays. You do not want something to take a half hour, 45 minutes, an hour. If you're going to take that long, there better be something for them in the end, like some kind of incentive. You also want your survey to get it right the first time. It's very disheartening when you send a survey out, you start to get responses, and you realize, we didn't ask the right questions. This is not what we need. So it's important, that's why that testing is important, to find out that the responses are going to answer what you need to know. So the upfront work to survey development is really the most important part. And that you put time went into the planning, the development, and the analysis plan. You spent a lot of time, so when things start to happen and things start to pop and you start to get stuff back, you know what you're doing. Okay, I don't know if Sarah's going to be able to do this. I was goofing around with some music yesterday.
It's going to take
I
you
don't know,
1
Sarah, can you get it to
second.
go?
Yeah.
You guys probably have some idea what music I'm going to play here. I'm probably the only person old enough to know this music. Okay, you got the idea. Good old Clint Eastwood, the good, the bad, and the ugly. Sorry, I've got a frog in my throat. Just 1 second. Can you hear me?
Yes, now
Can
I
you
can
guys
hear
hear me
you.
now?
Yep.
Okay, sorry. These examples of questions came from Qualtrics, which is a version of software that we use here at the University of Iowa for doing surveying online. And the thing I like about it is it does a lot of your heavy lifting when it comes to statistics. So if you're able to access this, and at the end I've got links for these, if you're a little shy about doing statistics, it'll do a lot of that for you. So the first question is, the government should force you to pay higher taxes. That is not a great way to answer a question. Part of the problem with that is force you is a very strong word. Higher taxes, very, another thing that so people kind of have a gut reaction to this. And they have found in research that if you've got should, would, might, those kind of things tend to bias responses at about a rate of 20%. So the more you can stay away from those kind of wordings, the better you are. So another option could be, a better option could be taxation is the role of the government. Yes or no. It's not saying one thing or the other. It's a statement. Do you agree with it or not? So you really want to take out some of those words that kind of bias folks because they're such strong words. What's your age? This one, your options are 0 to 10. I personally haven't seen a lot of 1-year-olds taking surveys. 10 to 20-year-olds, 20 to 30-year-olds, 30 to 40-year-olds, and 40 plus. Couple problems with this. If you're 10 years old or 20 years old or 30 years old, which box do you check? It's redundant. Also, I think it's a little ageist to have 40 be your highest age. It kind of tells the person taking the survey that this is skewed towards youth. Now, if it is skewed towards youth, that's fine, but you've got to be careful who you're sending it out to. So a better way to put this would be, what is your age? I would take out the 0 to 10 altogether personally, but 11 to 20, 21 to 30, 31 to 40. So each one is on its own. How would you rate the career of legendary outfielder Joe DiMaggio? Again, there's some bias in here, and the bias is with the word legendary. When you read that, you're already under the assumption that someone thinks he's legendary. Someone thinks he's really good. So, wow, he must have had a really great career, or they wouldn't have called him legendary. So people might skew this higher because you put that word legendary in there. You put a word in there that's going to put something in their mind to make them rate something differently. Another way would be a better way would be, how would you rate the career of baseball outfielder Joe DiMaggio? Joe DiMaggio, baseball guy. That's all you know. If you don't even know anything about Joe DiMaggio, you know he played baseball, you could rate the career without that bias in there. These questions, what is your race? What is your age? Did you vote in the last election? What are your religious beliefs? What are your political beliefs? What's your annual household income? These are questions that are very personal, and people sometimes do not want to respond to them. So if you put in race and you put in, African American, Caucasian, Asian, whatever, and you did not give a do not respond or prefer not to answer, you're not giving people a way to not answer it. So, and what you'll end up with is missing data, because people will, if they don't want to answer it, they won't check it at all. So you always want to give your respondents an out. You want to give them the courtesy of allowing them not to answer a question. And if they've got that option to not answer, they're more inclined to answer. What is your age? Most people, it's a tough thing about age, because if they put down 48, well, they're 48 the day they took the survey. You don't know when their birthday is. They could turn 49 the next day. So sometimes scaling is a little easier because you're going to kind of aggregate ages anyway. Voting questions, again, very personal. Religious beliefs, very personal. Household income, I tend to use a scale with that, and I tend to go off the Office of Management and Budgets for the United States has some really good scaling questions for these kind of things. They'll give you scales around poverty. They'll give you scales around averages. So if you don't know what to put in there, there's some really great scaling questions that will actually show you where someone is in the poverty. So always give people a not applicable, prefer not to answer, some way to get out of the question. What is your opinion of Crazy Justin's auto repair? So you've got pretty good, great, fantastic, incredible, the best ever. So if you went to Crazy Justin and he really screwed up your car, you would have no way to tell people that. The crummiest thing on here is pretty good. And personally, if someone did something not well to my car, pretty good is not how I'd answer it. So in your head, think about a teeter-totter. Remember a teeter-totter? You've got all the responses on one side. Everything from pretty good to best ever is on the right. Everything's going to be very weighted towards Crazy Justin does a great job no matter what. So what the better option is, what is your opinion of Crazy Justin's auto, which would make it more even on that teeter-totter, is very good and good being on the right, fair being in the middle, and poor and very poor being on the left. So this kind of gives the person an option to say, they did a crummy job. So Crazy Justin might not want anybody to say bad things about his car business, but if you're doing this to really see the validity of something, you need to have a better scale. What's the fastest and most economical internet service for you? That's really two questions in one. Sometimes the fastest isn't the most economical, and the most economical isn't always the fastest. So people are looking at this going, well, I don't know. So some options, and they might answer they might answer one but not the other. So the best way to take a question like this is to cut it into two questions. What's the fastest internet service for you? And instead of just having them write that in, if you know the region you're surveying and you know who the services are, stick it in there. Mediacom, Liberty, South Slope, those are local to here. I don't have internet service. You're giving them the opportunity to tell you, this is moot to me, I don't even have it. What's the most economical? Same bunch of choices. So this way you can look at what's considered fast, what's considered cheap. Scales, scaling, Sarah and I actually had a kind of a long discussion about this yesterday, and scales are, there's really, in my opinion, no gold standard for scales. There's no scale I can say, this is the best scale, use it every time. You've got dichotomous, which is yes, no. There's only two options, yes or no, agree, disagree, true, false. The good thing about the dichotomous scales is there's only two answers, so it's easier to do your analysis. 3-point scales, I've put a couple examples here. Extremely, moderately, not at all. Too much, about right, too little. If you Likert it, it'd be 1, 2, 3 or 3, 2, 1, depending on how you want to look at it. A 4-point scale, strongly agree to strongly disagree. There's no middle range on that, really. And then you've got your 5-point, which tends to be a little more traditional because a lot of times those have a middle. Excellent, above average, average, below average, very poor, very good, good, fair, poor, very poor, very satisfied, satisfied, neither, dissatisfied, or very. So you've got a middle range. And this is another thing that Sarah and I talked about yesterday, that I'm not a real big believer in giving people an opt-out option when it's important for you to know how they feel. I run into very few people who have absolutely positively no opinion about something. So if you're throwing a meeting or an event or doing something where you need to know, did you like it? Don't give people that cop-out option of nothing. I don't know, because I just think you kind of have to push people one way or the other on that. What you need to think about, though, when you do this is, what do you need to know, and how much of a range do you really want? Do you need 5 points? Would 3 points do it? Would 4 points do it? Because the bigger the scale, the more statistical stuff you'll need to do. I see some people do a 10-point scale, and I think it gets harder and harder for people to differentiate between a 9 and a 10, or a 7 and an 8. Let's say 1 is horrific and 10 is fabulous. That's a lot of differentiation between, and can you really say what the difference is between 5 and 6? So think through your audience, think through what you need to know, and think through how much scale do you really need. I've got a link at the end for a page on, it's called Data Guru, and they can give you lots of helpful scales, because sometimes you just don't know what to put, and they've got a whole sheet of different scales from dichotomous to 5 points.
Kellee, I have a question. Can
Sure.
you go back? Okay. I've always wondered
the scale.
with scales and when writing the survey, is it better if your first question is the 3-point from extremely, you're using that one, extremely, moderately, not at all. Well, then on your next question, if you're using a different scale, should you have it go the same way to like the disagree at the far right, or is it okay to have it flipped? Do you see what I'm saying? So that someone really has to read it.
That's a good question, Sarah. The problem with flipping it is people get it stuck in their mind which way something's going. And if you start to switch it, they might skew it poorly when they really mean high. If you're doing them as a matrix, let's say you're doing them as blocks, matrices, you could probably switch that around. But I personally think it's better to keep scaling the same direction all the way through, and then you can reverse code it when it comes time to do your, like if you've got a negatively worded question, you can change the coding on that scale. But I think we've seen this a couple times where we've in the past where the scales changed and people just kept with that method. That the higher numbers meant more agreement, or the lower numbers meant more agreement. So I think, and this is just my personal experience, I think it's easier to keep them all going the same way, unless you have a really good reason to flip it.
Okay.
Does that answer your question?
It does, and I just have had the same experience, like people accidentally flipping it. But I feel like if I'm taking a survey, I pay attention to the questions more if I realize that I have to that the answers aren't the same for every section.
Well, I think you might be an anomaly with that. Because, I mean, I'm sure you've all seen surveys where they've got like 5 questions and 1 to 5, and 5 means good, and they'd make one big circle around all the 5s. And you kind of wonder if they've even read the questions at all.
All right.
So I have a lot of faith in human beings. I don't have a lot of faith that they're going to read all the instructions really well. So I think the simpler and easier you make it for them, that they don't feel like they're being tricked, the better off you are.
Great. Okay.
Does that help?
Yes, that's perfect.
Okay. So now some conventional wisdom about question wording. Simple, direct, comprehensible, no jargon. And by jargon, I'm talking about any kind of acronym, anything that might be something internal to your agency. We do the blah, 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 blah. It's got to be stuff that if you handed it to Joe on the street, he'd be able to read it. So be very careful with your acronyms. You can use an acronym, explain what it is. Be very specific. Avoid ambiguous words where people really have to sit there and kind of think through what do they mean by this? I'm not sure what they mean. If they have to put that much thought into it, it's not a good survey. Avoid those double-barreled questions. That's the one about the economical and fast. It's asking two questions. Avoid leading questions. Those are questions when you're kind of trying to point someone in a certain direction, and that's not surveying. Surveying is getting their honest opinion about something. So you don't want to kind of write the question in a way like that one about taxation, forced to pay taxes. That kind of gives the reader an idea about where you're coming from on that question. Include filter questions. A filter question is the one that you've seen these, and they're much easier to do on an online survey because you can put in software, or you can write stuff into the code that'll let them move on. So let's say your questions are, you want to talk to women over 40 about mammography. I've been doing a lot with BCC EDP. So you ask their age, you ask this, you ask that, and you only want to find out from women who are 40 plus who have not had a mammogram. So if they check yes for 40 plus, yes for not had a mammogram, they're going to answer a certain set of questions. If they say no for under 40 and yes for having a mammogram, you might have some other questions. So what it does is lets your person taking the survey only answer questions that are relevant to what they checked on those kind of screener questions. It's a great way to take people out of the mix who really don't have anything to do with what you're asking. They might have responses to other questions, but it doesn't relate to what they know. It's easy peasy to do with any kind of online surveying. It's very difficult with paper because, again, sometimes people don't read the questions and they don't realize, if I say no to this, I've got to go to 16. Sometimes they just don't pay that much attention. So they're great because it can kind of stratify data out for you, but it really depends on how willing they are to read the instructions. Be sure the questions read smoothly. I always read them out loud because sometimes it sounds great in your head, but then you start to read it out loud and you're like, well, that makes absolutely no sense. So read it out loud. Avoid those emotionally charged words, hate, love, anything that's going to have some kind of emotion for people. And allow for all possible responses. And I don't know is a perfectly valid response. If you don't know, you don't know. It's better than having someone guess. So prefer not to reply, not applicable, I don't know. Don't feel bad about putting those in there. So this is not how someone being surveyed should feel. They really shouldn't feel like they're being interrogated, that someone's really jumping on them with all this stuff. I kind of think back to when you used to do the, what are those things called? It starts slow on one side and it goes up like you're going to a mountain, then you go down the other side. When you write your survey, think that way. Think that, okay, let's start with some simple questions, then we'll get into those little tougher ones that might be a little more personal, start asking some demographic questions, and then close with another easy question. So kind of get people comfortable before you start asking. Don't ever start with the big, tough questions. Start with some general questions and then move into the tougher ones. Sarah just asked a question about, is there a magic number of questions that most people will answer, and more than that number they will stop the survey? That, again, is another question that's pretty relevant to your crowd. We have a project right now where we've got one survey that we do that's got 105 questions. And I would say about 90% of the people finish all 105. And they know they're going into a study. It's an actual study. And we still have people that don't complete it because it's just overwhelming. And this came from another unit. It didn't come from us. It's just something you need to think about. If you're going to do something on the internet, I would keep those shorter rather than longer, because unless you've got that little persistence bar at the end, because sometimes you get going on those things and you're like, when is this going to end? I don't know when it's over. And if people can't tell when it's going to end, they might opt out of it. Paper surveys, again, we actually test our surveys on time to see how long they're going to take people, and we're able to tell people. Like we have another survey we're doing right now. We tested it with a bunch of people. It took everybody less than 10 minutes. I think on average it was 6.5 to 7, so we tell everybody it's going to take 10 minutes. That way if they get done faster, like, well, that was quick, I got it done. So you always want to give them an idea how long it's going to take, but I really think if you start to go above 20, 25, either it should be done a different way, maybe with an interview, or you just are kind of overwhelming the people with the amount of questions. You don't want them to stop in the middle. That's really frustrating when they've done it. Because that to me, it's like, okay, do they want to not answer this at all, or can I take the half of the questions they've written? Crystal had a question about filters. Crystal, filter questions are, let's say you've got people coming into a study, you've got women coming into a study, and you really want to know how they feel about mammography. So you've got the question of their age, so you've got how old they are, and then you ask them whether or not they've ever had a mammogram. And if they've had a mammogram, you have one set of questions for them to answer because they've already had one, they've experienced it. And if they have not had it, you've got another set of questions. And of the ones that the women who have not had a mammogram, you can separate those out by age. So if they're over 40 and have not had a mammogram, I want them to answer these questions. If they're under 40 and not had the mammogram, I might want to be able to shut down a survey for them. We appreciate this, but this really doesn't address, thanks for being a part of this. You're done with the survey. So what you can do is just it's almost like, think about you're at a park and you're going on a trail. And you get to the trailhead and there's 3 different trails you can take. One's 5 miles, one's 2 miles, one's a little 1 mile jaunt around a loop. You ask a question that sends people on their trail. That way you've got someone, you haven't got a 25-year-old answering questions about mammography when they really have never experienced it. So it kind of sets people, so think about that. That filter question is, what trail are they going to go on? Does that make sense? If you could just type in a yes or a no, that'd be great. Great, thanks. So should you survey everyone or just take a sample? There's really just 2 categories. There's random. You take a random sample, and random means random. You throw everybody in a bag. You start pulling out people. These are the people that are going to get the survey. Non-random is which most people that are involved in the consortium are going to do, is it goes to the people that are involved in some kind of project. So if you're sampling, how large should the sample be? I've got a calculator tool on here that I think will work. Let's see if that'll come up. Yep, there we go. Can everyone see this? It says survey system. Sarah, can you see it?
You do the share your screen. The web links won't
Okay.
work.
Is that in the pod?
Yep, pods, share, and then
Share 4.
there you go. Yep,
No.
share my screen.
You guys can see it?
Um,
Okay, so samples, can you see it?
no, not yet. I think you have to click share my screen.
Sorry, guys, this is my first time doing this. What do I click on for that? I'm sorry.
Just share my
It's
screen.
under pod, right?
Yep, pods, share my screen, and then right under that is share my screen again.
I'm seeing share, but I'm not seeing share my screen. Oh, share my, oh, never mind, I see it. Share my screen again. There we go.
It's thinking.
Can you see it now?
It's still thinking, or at least it is on my screen.
Well, we'll just let it go.
Okay.
The link to this is at the end, and I'll just kind of talk you through what it looks like. Sorry, everyone. It basically asks you what your confidence level you want to be, and think back to your college stats. You've got 99% or 99%. That's how confident you are. The standard tends to be 95%. The confidence interval, I normally put in a 5. And then you put in the size of your population. So let's say you've got 300 people that came to a meeting. So you'd put your 95, you'd click in your 5 for your interval, you put in your 300-person population, and you hit calculate. And it'll tell you that to get a statistically significant sample size, you'd need to sample 169 people. So it basically will tell you, if you're not able to survey the whole group, how many you would want to sample. Response rate. So what is a response rate? Response rate is the percentage of people who actually responded to your survey. The way you get that calculation is you take your total number of surveys returned divided by the total number sent. So if you sent out 100 surveys and 25 people responded to them, you'd have a 25% response rate. There's no single rate of return that is standard, as it really depends on your population. If you're working with a group of people you work with quite a bit, you'd probably be looking for a higher response rate, like 90%. You would really expect them to respond. If you're sending something out to complete strangers just to kind of test the waters, you'd probably be looking at a low sample return rate. The problem with this, the lower it is, the less reliable it is. So you really want to try to work and get a higher response rate. I have found with online surveys, especially if you're able to track email addresses, and a lot of the surveys like Zoomerang, SurveyMonkey, Qualtrics, they will allow you to track by that. When you do your reminder, it'll only go to people who have not responded. So it allows people who have not responded to have the option to do this. I like to see 60 to 70%, and sometimes it takes a couple of reminders or nudges on people to get them to do it. Sometimes you're at a meeting and you're passing something out. A good way to get a response on that is, stand by the door and collect them when they turn them in. If it's something that's highly sensitive, give them an envelope to put it in so they feel more concerned with that. So Sarah put up a population target audience we've had the hardest time with, and we've gotten physicians and participants who want to get out of the meeting and don't complete the survey in a thoughtful way. A good way to do that is don't wait till the end of the day to do the survey. If you've got a meeting that, let's say, is going from 10 to 4, do the survey after lunch. Or do the survey an hour before you're going to, because people do want to get out the door. And if you can back that survey up a little bit so it's still part of the meeting time, unless something really heinous happens, the opinion they've got at 2 in the afternoon is probably the same opinion they've got at 3 o'clock in the afternoon. So to get around that, the physicians thing, I couldn't tell you. That's a tough crowd. I think a part of the issue is they don't answer a lot of their own mail. They've got other people who do it. We've actually had that problem with a survey we just sent out recently where the secretary responded, which is great, but her opinion is not the physician's opinion. So that's something where maybe a survey isn't the best way to get there. Maybe you need to do a phone interview. So looking at your response rates, what are some of the things you want to do? Target your audience. Make sure you're sending this survey out to the right people. You're not just scattershot sending it out into the ether. Make sure you're sending it to the right people. Personalize your email invitations. This is a little bit of work on your part, but Dear Kellee means a lot more to me than to whom it may concern or Dear Respondent. Take the time to do that. Outlook or whatever you're using for a lot of email programs have gotten much more user-friendly for this kind of thing. A lot of things, SurveyMonkey, some of those places allow you to send email through there, and you can put a mailing list in, and they will populate that. So if you can personalize it, that can have a little increase in your response rate. Keep your email invitations short. You just need to tell them what it's about. Tell them what it's about, how long it's going to take, what you're going to do with the results, and a little bit about confidentiality. I think a paragraph and a link in an email is plenty. If you're putting a cover sheet, sometimes you don't even need a cover sheet. Put the information on the survey. The less paper, the less cumbersome. Make your first survey page simple. Let people take the survey. Unless you're bound by some kind of IRB or human subjects where you've got to have some kind of assent or consent, let them take it. Let it go. Be very clear about privacy protections. I try to tell people it's going to be returned in aggregate, and we're going to mush it all together, and we're going to pull out, by mushing it all together, we just talk about percentages. Because you're never, in a survey situation, you're never going to say, well, Jane said this and John said that. That's not what they're for. They're about getting aggregated data. So the clearer you are about what you plan to do with this, who you plan to share it with, how you're going to protect the data, the more it calms down people, especially if you're asking very sensitive questions. Send reminder emails. I normally just keep a little folder in my email with a project, and I'll say reminder emails and the date I sent them. And I tend to see a pretty good bump, especially on online surveys. Like I'll send out an email, let's say today, and tomorrow I'll check my surveys, and I'll see a pretty good sized bump. Because sometimes people are like, oh yeah, I forgot about that thing, or I accidentally deleted it, and people will respond to that second one. If you can, and it's in your budget, consider offering some kind of incentive, a gift, a prize, a drawing. Maybe you'll say we'll have a drawing for, when we get 100 surveys back, we'll have a drawing, we'll offer you blah, blah, blah. Don Dillman is kind of the guru of surveying. He has a method where he puts a crisp dollar bill, like goes to the bank, gets brand new dollar bills, and sticks it in with the survey, and he found that really helps with the response rate. That's the hard thing for us to do here at the university. We can't just send money in the mail. But, if you've got a small group and you really want to get there, something about that dollar, people feel a little more inclined to do it. Also with mailing surveys, if it's got an honest-to-gosh stamp on it and comes with that self-addressed envelope, people feel more inclined to want to return it. And also if your survey's in a bright color, because if you look at your desk, it's mostly white paper. If you've got a bright yellow or a bright pink, it sticks out a little more. Another thing for response rates is sometimes people just want to share their opinion. Maybe you close with, do you have any other opinions about this? Do you have any other thoughts about this? And people can share those in the survey. Use graphics and internet features strategically. Don't overdo it with bombs going off or lots of art or graphics. Don't do anything that's going to muddy up the message or send a message you're not intending. And publish your results online to survey participants. So if, let's say you're surveying a group that came to a meeting you had, and a month from now you're going to send them an update, let them know how people responded. So let's see what else we got up here. Rachel, do you ever use faces in your surveys? Yes, I've actually seen quite a bit of that, especially with young children. Because smiley to them means like good, frowny means bad. So, for like second, third graders who really don't read that well, you can use those kind of ideas. What else we got here? Oh, Sarah's incentive. Eternal gratitude. Okay, so now what? You've put together the survey. You've tested the survey, you've sent it out, and now it's starting to come back. And if you're very lucky, you'll look like this woman with everything piled up behind you. There's nothing more exciting when you it's nothing more exciting than getting survey responses. I can't even explain. I've been doing this a long time, and whenever we put out a survey and I start to get responses on the internet or in the mail, I'm like, yay, here comes the stuff. It's very fun, and it's really interesting when you start to read, because a lot of people will answer the yes, no, but then they'll be writing in the side or in the margin and letting you know other information, which is kind of fun. So data management. Data management is crucial to your analysis. Have that plan in place. So when stuff starts coming in, you've got a place in your office where it's going to go. You know what's going to happen with it. You're not getting overwhelmed by that, because you tend to, if you're sending out a big amount of stuff, you might get a whole lot back right away. And if you don't have a plan in place, you could lose something. If you're using online surveys, your data will be stored for you, and they can usually run crosstabs for you, which is like a 2x2 table. It can sometimes do other things for you. You can say, I want everybody who responded yes to this question and no to that question. So that's kind of fun, but you do have to spend some front time understanding how the program works. If you're using paper surveys, you'll need to enter the data into Excel or SPSS, which is a statistical program, code your responses, and analyze your data, and we're going to talk about that in a minute. So it really depends on what's better for you, but keep in mind the work that's going to go with it. So coding responses, this is a simple way of saying we're going to turn words into numbers. So if you're using a multiple choice or a yes-no survey, you'll want to code your responses for easier analysis, because when you think about it, your analysis is going to be done mathematically. And codes are what speaks to your statistical software. So for example, traditionally, if someone says yes to a question, it gets coded to a 1. And if they say no, it gets coded to a 0. Female tends to be 1, male tends to be 2. Prefer not to answer or not applicable. A lot of times people will make that a 99 because it's so far off that you can remove those responses and take them out of the mix. Because let's say your answer was, you had 3 responses, 1, 2, 3, and prefer not to answer was a 4. You might overlook that 4 because everything's in a sequence, but if you've got a 99, you'd be more inclined to pull it out. So here's an example of a coded survey. It's a CARPS survey about alcohol consumption. So the codes are in there for you to see. Sometimes you'll actually take a survey and see the code next to the box. I don't do that. I normally just have my own code book, and I'll show you how that works in a minute. But the first question is, are you female or male? They circle female. So they get when you get it back, you'll get a 1. And you can't, some software programs will let you give the codes in advance. So when you download it, it's already coded, and some don't. The second question is, how often in the last 12 months have you had 4+ drinks in one sitting? Choose one answer. So they've got daily or almost daily, which gives you a 1, 4 or 5 times a week, which gives you a 2, 2 or 3 times a week, which gives you a 3, 2 or 4 times a month, which gives you a 4, 1 time a month or less, which is a 5, and then you don't drink, you get a 0, which is interesting because higher numbers sometimes mean more, but here, more drinking is a 1. So the never people would probably be pulled out. And since they equal a 0, they're not going to mess up your averages. They're not going to mess up your percentages because they don't. The denominator would change. You'd need to pull that out for the denominator. But for your numerator, it's not going to have an effect on it. So code book, this is the way I think about a code book. If I was to get hit by a bus leaving work today, they would know what to do tomorrow. It's not all in my head. It's on a piece of paper. It's in my computer. And they'll know when they get a big spreadsheet full of numbers what all those columns of numbers mean. And some people think that this is kind of a big waste of time, but I truly believe that you cannot be the only person who knows how the data works. So codebook is a simple way of saying to, Ashley, who's my right hand here, if I don't show up for work tomorrow, she'll know that gender means 1 and male means 0, that no drinks means 0. She can go and look at all this. Basically what it is a table. You've got your variable name, and that's what, or the variable name or the question itself. You've got that in there. The variable label, and if you're going to run SPSS or Excel, you probably want to keep those under 8 letters. Unique ID, that's our participant code, gender, F drink for frequency of drinks. And then you've got your labels and your codes. So we know for unique ID, we always want 8 digits in our code. So if we have a 7-digit code in there, we know we've got a problem. We know that gender should only be 1 to 0. And we know for F drink, it should go from 0 to 5. And when you run your descriptive statistics and do those frequencies and your ranges, let's say you've run your ranges on F drink and you've got 0 to 7. You know somebody made a mistake. There is no 7. 7's not even an option. So something went wrong somewhere, so you start to look for that to clean it up. Let's see. Rachel has a question. Is it okay to use a mix of qualitative and quantitative questions in your surveys? Absolutely. The only issue is going back to that text box question. I would be a little light on the qualitative and heavier on the quantitative, because the people just not wanting to put a lot of text into something. Ashley had a question. Is there a reason we're saying last 12 months versus last year? Yes, we are. It's just easier for people to think that way. I don't know why. Because last 12 months, you're talking about from this date back 12. Last year, people might think last year being all of 2012. So the last 12 months takes you from this date back. Last year, people tend to think of it as that 12 months, that January to December as a month. Okay, so if you're putting this stuff into Excel or SPSS, this is what it's going to look like. On the first column, you'll have your unique ID. So this is Jane Doe, let's say. Then we have our gender. Jane's a 1, so she's a female. And Jane, for F drinks daily or almost daily. Our second person, 100002, is a male because he's got a 0. And for F drink, he doesn't drink at all. And then for our third one, 100003, we've got another female, and she has a 4. And what is a 4? Sorry, I've got to pull up what a 4 meant. I forgot already. Short-term memory. 4, she drinks 2 or 4 times a month. So if we were to talk about this data, we'd say we have 2/3 women, and of the people, of everyone who was involved, only the women were drinkers. So it gives you, we could look at this real basic. Let's talk about types of analysis. And I think Sarah's going to ask you a question about statistics. But quantitative data, how do you rate your comfort level with statistics on this one? Quantitative data for surveys involves calculating your basic descriptive statistics, your frequency, how many people answered each question, our distribution, what that look like, our measures of central tendency, mode, median, and mean, measures of distribution, the range. We talked about the range, the 0 to 5, if you get a 0 to 10. And you can run those real quickly, and it kind of gives you, if we've got a problem in there, it's going to pop up pretty fast. Interquartile range, how many people were in the top 25%, the bottom 25%, and then your standard deviation. We've got a very narrow, the standard deviation, how much error can there be on either side. So it looks like somebody has great statistical level stuff. We've got a lot of moderate. We got a little bit of low. We got some people who aren't answering at all. So we're not going to go into statistics today, but this is just something for them to know for the future. So let's say you want to ramp it up a little bit. You want to do a little bit more than those frequencies. Crosstabs, very easy to run in Excel and SPSS. Same with chi-square. Chi-square will actually give you the statistical significance. A t-test, independent sample, paired, or one sample. Paired t-test is actually really good if you're doing a pre-post, because you can compare Jane pre to Jane post. John pre, John post. You can see if those people learned anything. And choosing a statistical test is really reliant upon whether or not the data is categorical or continuous. So you really need to know, what are we collecting? Are we doing dichotomous? Are we doing a scale? And then go from there. So guiding questions and options for your method decision. Think about when you're done with this, what's the purpose of your report? What are you going to do with this when it's all done? Who's your primary audience? Who are you going to, are you giving this back to the consortium? Are you giving this to a boss? Are you taking it on the road and sharing it with other people? Think about what you need to who you need to share with and what you need to share with them. What questions will guide the reports? What data will answer or illuminate the report questions? Every survey starts with questions. What do we want to know? Here are the questions that should answer that. Does this data answer those questions? What resources are available to support the report? Do you have the time to sit down and write a really big report? Do you have the money to support that? Or would a white paper work instead? Or a few PowerPoint slides? What do we need to do with this? What criteria will be used to judge the quality of the findings? If you're going to send this to the New England Journal of Medicine, they're going to have really strong criteria. They're going to expect lots of stuff. If you're going to send it to a group of people to share it, they still want to know it's right, but they're probably not going to expect you to run the same level of statistics. So think about who's going to look at this, who's going to judge it. You know, if you think the Press Citizen, the Gazette, the Des Moines Register is going to get their hand on it, you know, make sure what you're doing all makes sense. Who's your audience? Is it internal to the project? Is it external to the project? What is it you need to show? What do you need to show back to those folks? And what do they want? Do they want a PowerPoint, a written report? It's a really good idea to clarify this. You want to clarify this from the get-go. What do you expect from me at the end of this? I know the consortium and their RFP process lets them know what they want. What do they need versus what do they want? Get the needs first. A lot of people want lots of stuff. You are not going to have the time probably to do it or the budget to do it. Get the needs taken care of first. The wants might get answered through the needs, but really keep a hierarchy in mind. Okay, this is what they need done. This is the stuff, if I've got extra time, extra money, I can do. But get clear on that. What do they intend to do with the results? If you're handing this off to somebody else, you need to know what they're going to do with it next. Interpret data for your audience. People love charts. They love bar charts, pie graphs, anything where they can visualize data. It's very helpful. It's also really helpful not to use a lot of statistical language. People kind of shut off their brain. Even if they're statisticians, they're kind of like, you know, this is statistically significant. That's probably all you need to say. You don't need to say, you know, p-value 0.001. You probably don't need to go to that level. Just let them know this is what it is, this is what it means. Again, use graphics, make it very visual. If you've got some qualitative and you've got some really good comments in there that you want to pull out, put those in there. Here's a comment, here's a comment. You know, obviously, like I say, Jane said this. It would just be a comment. But if you've got comments that'll back up data, that's a great, people like that real life kind of stuff. So as we wrap up and have some time for questions, here are some books worth spending your hard-earned money on, in my opinion. I think if you do any kind of surveying, evaluation, any minor research, anything, these are great books. Mail and Internet Surveys by Don Dillman is a classic. It's a great book if you plan to do any surveying. Evaluating Health Promotion Programs by Tom Valente. This is a great book for anybody who does health promotion stuff. It really walks you through soup to nuts how to run a program. How to Conduct Surveys, Step-by-Step Guide by Arlene Fink. I like Arlene Fink because she starts at the beginning and walks you through piece by piece, and it makes sense, and she has lots of examples. Improving Survey Questions, Design and Evaluation by Floyd Fowler. This is an oldie but a goodie. He kind of talks you through how to kind of up your game, how to write a better question. Here's some survey software, SurveyMonkey. A lot of people used to use Zoomerang. Zoomerang still is a website, but they're actually now part of SurveyMonkey. SurveyMonkey is free up to a certain amount of responses, so that's something to think about. Cvent is another web surveying software, and then Qualtrics. I don't know if Qualtrics is available to just, if it has to be a site license. You know, I think Qualtrics, you have to buy it as an organization. So here's some websites I like. Surveysystem.com has that scale, that calculator about how uh, has a lot of response options. Like, I want to ask, I don't know what kind of scale to use on this question. I'm not sure what sounds right with these questions. And they've got a bunch of options that are really helpful. Then this random sample, this is another random sample calculator that's helpful. So there's two different calculators on here that I find helpful for
Now we can. Yep.
Can you guys hear me? Okay. Ashley said it was me. Yeah, it's just you. Okay, you can hear me. Okay, sorry. If
Can you go
everyone's
back a
giving you
slide?
glowing comments, pardon me? Go back a slide. This one?
Yep.
Crystal, is this the one you want or another one? Okay, great. If you've got, let's say you've got a survey that's got some text boxes and some scaling. And the text boxes are going on and on about how this is the best thing they've ever done. It was fabulous. They're glad they came. Best, you know. But the Likert scale, they circle all ones, thinking that one means great. I am perfectly okay if the text says one thing and the scaling says another. The text is what I trust because the text is what they actually took time to write. So if the text is glowing, I would probably change the scale on that on those questions. I don't think I'd take it to super high. I wouldn't take it all the way to a 5. If that's your highest, I might take it to a 4. But it's almost like they looked at the scale and read it backwards. If you see that happen a lot, though, you might have a problem in how you're presenting your scale, which is really water under the bridge when you've already done it. But any questions on anything I've talked about so far? I know this is something that you can do a whole semester worth here at the university. So I kind of ran through it pretty fast. Any questions? Sarah, do you want to take them off mute or?
Yeah, if you're on the phone, if they're listening through the phone, they can unmute their phones or they can type in the chat box.
Okay, great. I'm trying. Did I miss anything in the chat boxes?
And I'm going to also turn on the microphone. So if you're at your computer and you have the microphone on your computer, you'll now be able to talk through your computer. There should be a microphone symbol up at the top, kind of left-hand corner, and just make sure that's turned on.
Did you guys hear my response to Sarah's question about the incorrectly? Was that all heard?
Yep, I heard
About
it.
the okay, great, good.
Wait, if there's anybody who has more questions, they can while they're typing them in there. If you look in your computer, I opened another screen that is the survey for today's training session, which I did when Kelly said I should do it not at the end of the session, so I was listening. So hopefully you can fill that out. Otherwise, I put the link up in the chat box. Would love it if you'd fill that out. It helps us with our evaluation. And we'll have the recording up on Cancer Iowa. Probably within a week or two, and then if you're interested, there's 2 consortium events coming up. There's the Latino Cancer Summit in 2 days on the 24th in Iowa City. The registration's on Cancer Iowa, and then the last in our series is the session on survivorship, where I have a speaker from the National Center for Cancer Survivorship on June 18th, and that's also available to register through the consortium's website. So now I see you have some more questions.
Yeah, and Rachel, we actually have 2 projects right now that are using iPads. What we use here at the university is a system called RedCap, which I think probably any kind of cloud-based surveying tool would work for that, and it's been fabulous. The nice thing about it is we've got people in the field surveying, and they use that iPad, and also people are kind of fascinated by them. You know, they can touch buttons, and they can just kind of use their hand to do it. It's kind of a fun way to survey. What's important about that is that you have the capacity for any kind of confidentiality, because it does go to the cloud. So I know we're using that in 2 projects, and it's been really good. They're able to take these things on site. They sit down with people and just either have them fill it out themselves, or they do it, and it kind of moves right through. It was called, yes, it's called REDCap, REDCAP. Ellie, I haven't a clue what a QR code is, so if you can tell me what that means, maybe I can answer your question. Just how do you feel about?
I think, Allie, if this is right, tell me. QR codes are those little. They look like things you'd scan with your smartphone, and then it opens it up. Yeah, there you go.
Oh, okay. We're not that technologically advanced here yet. But I know it's that thing where you just kind of show it and it pops up something. I have never, personally, I've never taken a survey that way, and I haven't tried it yet. I'm actually going to a conference this summer about technology and evaluation, so I'm hoping that's something, because I think really the way of the future is going to be people doing things through their phone and stuff like that. So when the more I learned about that, the more I'm willing to share with the consortium. So when I find out more about that, I'll be happy to share it. But I love the iPad idea. I think it's a great way to take stuff to meetings. There's also things with the clickers that you can survey in meetings. I know they've done that a couple of times at consortium meetings, where you've got a big meeting and people have a clicker, and you get the results right there up on the screen, which is kind of fun. Sometimes I've noticed the response rates can be a little low with that, but I think it really depends on the question you're asking. Any other questions? Well, I appreciate everyone who's come on and listened today. My information is on this slide that's on the screen. There's my email and there's my phone, and I'm really happy to answer any questions you've got. So please feel free to drop me an email or send me a phone, call me, and I'll be happy to help you out.